It's been 2 years now since the pandemic that Principal Chief Chuck Hoskins Jr. has had to deliver his State of the Nation speech by video instead of in person and in front of a large audience. This year's speech was no different, and during the speech he cited some great achievements and even stood up to Governor Stitt. More on that in a moment. But there is some great news coming out of the tribe with plans on building a new medical facility to replace the W.W. Hastings Hospital and begin investments toward a new medical behavioral health network. Recently, he made some comments about that, so let's take a look.
After a decade of dramatic expansion of the Cherokee Nation health system, we must keep investing. I propose that we address our oldest health facilities. Let us build a new hospital to replace W.W. Hastings using the latest in hospital design so that our people have access to the best health care possible. Let us repurpose the existing Hastings facility to be the heart of our expanded behavioral health programs.
Joining me now is Principal Chief Chuck Hoskins Jr. Thank you, sir, for being on the show today on Perspectives. I appreciate you giving me the time to visit with me.
Oh, glad to be with you, Royal.
Now, it wasn't too long ago you guys were over there in Tahlequah remodeling that whole facility, so you're wanting to rebuild or replace W.W. Hastings. Tell me more about it.
Yeah, absolutely. So we really have two real important objectives in Cherokee Nation Healthcare. One is to complete what my predecessors, principally Chief Bill John Baker, started, which is to make sure that our facilities are state of the art, that they are worthy of the men and women who work in there, and most important, worthy of the people who seek healthcare in there. And at this point, other than Hastings and another facility in Salina that we need to replace, they're all modern, multi-million-dollar facilities that are, again, state-of-the-art, the most efficient layout for healthcare. So with respect to Hastings, it was originally an Indian Health Service. That's a federal agency constructed facility. We took it over more than a decade ago, have, I think, operated it much better. But it's a facility that has served a good purpose, but it's outlived its usefulness in terms of an inpatient facility. We have a much greater demand for that service than that building will provide. And, you know, over time in the healthcare industry, we learn more about the best way to deliver healthcare in terms of physical layout and amenities, and we just need a modern hospital. So if anyone comes to Tahlequah, they see that great investment we made with the OSU Medical School. They see the largest in the country, about 480,000 square foot outpatient facility. Then they see the older Hastings facilities. Well, on that same campus, we can actually build a bigger and better hospital next to the new outpatient facility. So that's one objective, part of completing this vision of having the best in facilities around. But the other very important thing is we have to do more on behavioral health, which we can dig into in terms of that issue. But in terms of physical space, that W.W. Hastings Hospital is still a useful and good building. We've put some investment into it. So we're going to repurpose that to be the heart, the hub, if you will, of what we want to build, which is a comprehensive behavioral health system that also addresses drug addiction, which is a big problem among our people. So I'm excited about it. It's a big investment, but everything's aligning nicely to be able to do that right now.
So when it comes to behavioral health, are you working with third-party groups like Grand Lake Medical, Grand Lake Mental Health, and a few others, or are you going to take it in-house and do it yourself?
Well, we already work with those great partners, including Grand Lake Mental Health. I'm glad you mentioned them. They provide a great service. We work with other outside providers, and I think to some extent we'll continue to do so. But to a great extent, we do contract out some of those services. Do a lot in-house, but some of the services are contracted out. I think our healthcare system, one of the success points about it has been that we have increasingly taken control of our own healthcare destiny, managing programs, staffing up our programs, determining what fits best for our Cherokee patients and other Native American patients. I think particularly in behavioral health, we can do that and do it well. So I think you will see a lot more come in-house. We'll still use our valued partners because they do great service. But you think about if a Cherokee needs to go to a detox center, for example, we don't have that in a comprehensive way at the Cherokee Nation. If you look at what happens with a person struggling with addiction once they go through detox, and I'm not a medical expert, but I learn a great deal from our staff, you see that there needs to be a spectrum of care. And so as they move out of that immediate, really dangerous period where they need detox, they need to move into a transitional phase. And we want to make sure that that transitional phase takes a person into recovery all the way through really getting back into society and becoming whole in terms of employment, in terms of making sure a person can take care of their children. That means having their children maybe close at hand in a transitional living center that's suitable for that. That's going to take a great deal of investment. It's going to mean investing even beyond Tahlequah, but it's going to mean, I think, doing more than what we can rely on with our outside partners.
Well, the pandemic has been no friend to anyone, and it has really hit the nation hard, including the tribal nations, and you are no different. So how have you been able to manage COVID within the nation?
Well, we've, I think, started in a strong position in two respects. One is, I come in office of principal chief in August of 2019, and of course, COVID's not too far off, and nobody knows it, including myself. And then it hits us. But I really benefited from successive chief administrations, decades of investment in a healthcare system. So we had a healthcare system that was already very robust when COVID hit. That is good. And even things like modern facilities where you can separate people and employ strategies to keep people within your facility safe during an infectious disease that we were just, in 2020 kind of wrapping our minds around. Having those kind of facilities helped us a great deal. I can imagine if I look back at the time when I was born in Claremore Indian Hospital in 1975, or back when my father was born in that same facility in the 50s, or other times in history, I can imagine Cherokee Nation not having the ability, from a resource standpoint or even a control standpoint in terms of federal policy, of being able to do what we've done in the pandemic. And I think we've led strongly, but we've done it with a lot of great healthcare assets. And of course, the greatest asset in healthcare is the men and women who work in our health system. Here's the other thing we've done, though, Royal, is from the beginning, not just myself, but the leadership of the Cherokee Nation acknowledged that this is a worldwide pandemic. It's not an individual health problem. It requires listening to public health experts. I am not a public health expert, but I'm at least intelligent enough to know that I ought to listen to them, particularly since I'm not a person of science or of medical background. So I have leaned on and relied on, I think, some of the best public health and other medical experts in the country that work for Cherokee Nation. And I think it's served us well. And it's the reason we've had mask mandates at our facilities. It's the reason why, if you go into the school that we operate, that the first order of business is to keep kids and teachers safe, and then keep their communities safe through COVID testing, through, again, mask wearing. And we've also encouraged vaccination among our workforce to the point where we have over 70% of our workforce vaccinated. All of that, of course, is taking place in a region in which we are getting hit very hard by COVID. And so Cherokee Nation's ability to manage this pandemic, we don't do it in isolation. What we do is also affected by what other health systems do and other governments do. I think we're struggling in this region, and it's hurting our people. And we've lost a lot of Cherokees, and we've lost fluent Cherokee speakers. That worries me every single day. But I think we're doing our level best from a public health standpoint, putting safety first. That I think we've done as good a job as you can do to keep people safe. But we're just keeping that idea that we ought to be guided by science, facts, and compassion when it comes to making decisions on COVID.
Well, I know you're keeping in touch with other chiefs among the other tribes across the nation and governors across the nation. How is it you've been successful at keeping vaccination rates above 70%, while in other parts of the country, tribal communities are way below 50%? How have you been able to get that message out there?
Well, it really varies. So I think one of the things we benefit from is we've had a very consistent message from the beginning, even before there was a vaccine, that we ought to be relying in this worldwide pandemic. We ought to be relying on experts, and I can't say that enough. So if you consistently say that the message is follow public health guidance, I think it helps prepare the people you represent for being attuned to that and being accepting of that message. Doesn't mean it's perfect, doesn't mean everyone accepts it, but I think leadership from the top really matters in that regard. And I don't care if you're a governor or a mayor or the chief of an Indian nation. I think it's in your people's best interest to send a consistent message that when it comes to healthcare, it relies on healthcare expertise. It varies across the country, even across Indian country, in terms of vaccination rates in particular. And I could take you across this region that we're in, and I'm very proud of our workforce that's at 70%. We did incentivize that, and I think we were one of the first governments in this region to do it, to incentivize our workforce to take the vaccine. I think there's plenty of reasons to take it without the incentive, but the truth is the incentive worked. We had a workforce that was, I think, below 50% vaccinated, maybe even in the low 40s when we first rolled out the incentive, and we're now over 70% in a period of months, and very critical months. These summer months have been critical. But if you look across the region, and I look at counties where there's a high concentration of Cherokees, and that includes Adair County, Cherokee County, and I could really go across all 14 counties, I see really alarmingly low rates of vaccination. Now, we can't drill down completely to how much of that is Cherokee, but it has to be a substantial amount. It worries me a great deal that our people are not taking the vaccination as high a rate as really they need to. So we make the vaccine available. We have a consistent public health message. We also try to appeal to people's sense of protecting our culture. I mean, getting out of this pandemic alive means getting out of it alive with our elders who still speak the language, who have our life ways in their hearts and in their minds. That, I think, is appealing to a lot of Cherokees. So we're just trying, Royal, everything we can to get people to take this vaccine.
We only have a few minutes left, but since the McGirt versus Oklahoma decision, you and the governor have been at odds. Let's play a little bit of your speech from the State of the Nation where you addressed your comments toward the governor. Take a look.
To the governor of the state of Oklahoma, let me repeat what I said in 2019. The Cherokee Nation is the best friend the state of Oklahoma ever had, but we must be treated with respect. Cherokee Nation remains ready, willing, and able to resolve challenges through cooperative agreements. We have proven that we can do so on a win-win basis. However, the governor's ill-informed insistence that McGirt is a crisis that needs to be solved will be met with the fierce and determined opposition of the Cherokee Nation.
Only have a few minutes left, Chief, so why do you think the governor has picked a fight with you and everyone else in Oklahoma over this issue?
I don't know the answer to that any more than I know why he picked the absurd fight over the gaming compact, which was a futile effort that cost the state a great deal and cost a lot of goodwill between the tribes and the state. The same is true here. Look, if we start from the proposition that the Supreme Court was right, and I think most Americans would say the Supreme Court said the government of the United States ought to keep its promise to Indian tribes. And in 2021, that's a proposition that I would think every leader would agree on. After you agree on that basic proposition that the United States ought to be good to its word, then I think you go from how do we make sure that the decision is effectuated, implemented in the best way possible. The irony is of the governor taking this stance against the Cherokee Nation and the 5 tribes, it's actually been the Cherokee Nation, and not just me, but other leaders with the tribe, that have expressed a willingness to work through what can be some challenging jurisdictional issues on the ground, on the front lines, when we're talking about making arrests and making sure people are prosecuted in the proper jurisdiction. And we've been willing to do that from the beginning because we've really been doing it for decades. And yet it's been met with hostility from the governor. He's created this narrative in which the sky is falling and there's a great crisis. He's enlisted even media from outside of the state to sort of validate what he's saying, even though what he's saying is bankrupt of facts and any decent legal analysis. I've got to push back on it for the sake of Cherokee sovereignty, but also for the sake of public safety. Because look, my job as chief with this great team that I have is to make sure we build a criminal justice system that puts a blanket of protection over the reservation. That means everyone, whether you're Indian or not, deserves that protection. I'm trying to do that every day. Honestly, I don't have the time or the inclination to be fighting with the governor over whether the United States ought to keep its word. What we ought to be doing is working to make sure that McGirt works. It works for people. Victims are protected. People are held accountable. It's absolutely possible. It just takes work. It takes some real work and to cool the rhetoric.
Well, that's all the time we have. I could sit here for an hour talking with you because you are a great interviewee, and I love just visiting with you because you have the answers and you know you have a vision. You know where you want to go. Thanks for being on Perspectives today, Chief. I appreciate it.
Widow.
Well, Principal Chief Chuck Hoskin Jr. and the Cherokee Nation. Thank you for watching Perspectives. Sam will be back next week, I hope. For now, I'm Royal Ailes. We'll talk to you later. Bye.